Let's talk about femoroacetabular impingement and hip arthritis. I'm Matt Chu from Upright Health, where we help you think right, move right, and feel right. On this channel, we do research, share tutorials, and just show you how to move your body out of pain. So be sure to subscribe so you don't miss out on any future videos. If you've been told that you have hip impingement, one of the biggest fears that's probably on your mind is whether the bone shapes are going to lead to arthritis. Many surgeons will make the claim that bone shapes from FAI will cause arthritis down the line, and that's why you need to get surgery before you end up with hip arthritis. Now, is that true? Well, actually, it's not. One sports surgeon has actually written about this topic and says that he hears from patients all the time that they're worried that their FAI bone shapes are going to lead to arthritis. And what this surgeon points out is that there is actually no information that shows that the bone shapes lead to arthritis. In fact, in one 2011 study, researchers looked at 96 patients over an average of 18.5 years. They looked at people who are in their teens and all the way up into their senior age, like 65 years old. What they found was that these people, all of whom had hip impingement bone shapes, FAI bone shapes, had no problem with arthritis as a result. About 80% of them never developed arthritis. So there was actually zero link between the bone shapes and the development of hip arthritis. And what these researchers concluded was that given this information, there is no reason to use surgery on people with hip impingement bone shapes to try to prevent hip arthritis. Now, you might be thinking, well, what about more recent research? What about when you get older? What happens when you get older and you have these bone shapes? Don't you get arthritis then? Well, in 2015, an award-winning research paper was published that looked at senior-age athletes who had all kinds of hip abnormalities. They wanted to see if things like FAI meant that these senior age athletes were going to have more problems with hip mobility, problems with hip pain, problems with hip arthritis. And what they found in that study was that there was no link between the FAI bone shapes, even in these senior age athletes, and the experience of hip pain or hip mobility problems. The other question you may be asking yourself is, why are doctors telling me that FAI bone shapes and arthritis are linked if there are all these studies that show otherwise? And the answer is that the early research on FAI was always done by surgeons. And surgeons proposed this theory about the bone shapes and arthritis being related. But what they didn't do was actually do long-term studies to prove that. That's why the studies that I mentioned in this video were so important and why they are so important for you to understand. These studies were supposed to prove the link between FAI bone shapes and arthritis, but instead they showed that FAI and arthritis are not linked at all. Now you might be asking yourself, if the bone shapes don't matter, then what does matter in improving my hip mobility and getting rid of my hip pain? The simple answer is your muscles. Muscles move bones. They determine how bones interface. The muscles of my fingers help my finger joints move correctly. The muscles around your hip joints help the hip bones move correctly. So you want to put your effort and attention into the muscles around the hip, and that is a long process that requires you to really pay attention and learn about your body. What makes that process more difficult for a lot of people is that doctors, chiropractors, physical therapists, trainers have all already bought into the surgeon's myth about FAI and arthritis being related. So all these health professionals will often tell you that moving less is your only answer. A lot of these people will tell you that you need to basically stop moving your hip joints. And that is actually a guaranteed way to make sure that your muscles don't function well and that your hips hurt more. So you need to focus on using your hips well, learning how to improve the mobility and improve the strength and range of motion of your hip joints as you improve muscle control. If you're looking for ways to troubleshoot your own hips and to help your own hip muscles, be sure to check out the description box for helpful links. We've got a lot of free videos to help you with your hips, and we even have a program designed for you called the FAI Fix that'll help you go step by step through troubleshooting your own hips if you need that level of detail and help. If you like this video, click the like button and subscribe so you don't miss out on any future videos about hip impingement. And be sure to share this video with somebody else you know who has hip impingement so you can help calm their fears about arthritis too. I'm Matt Hsu from Upright Health, reminding you that pain sucks, life shouldn't.